In this video, we'll discuss about introduction part of cytopathology, basic introduction. What is the meaning of cytology? It is a branch of pathology. Cytopathology, it is a branch of pathology where we are going to study only cells. Study about cells is known as cytopathology, and not studying surrounding the blood vessels, tissue, capsules. Okay, just seeing cells. That's why it is called as cytopathology. Study only cells, not the surrounding. Name is called as cytopathology. This branch was found by Georges Nicholas Papanicolo in the year of 1928. So this branch was founded by Georges Nicholas Papanicolo. Cytology, which have three branches. One is exfoliative cytology, intervention cytology, then imprint cytology. So three branches: exfoliative cytology, intervention cytology, and imprint cytology. This intervention, it have two sub branches. One is fine needle aspiration cytology, second one is sediment cytology. FNAC, fine needle aspiration cytology, and sediment cytology. So first one is explorative cytology. What is the use? What is utilized in this explorative cytology? Studying about the cell which has been shut down, okay, surface into the body cavity or into the body fluids. It is shut down either body fluid or body cavity. This one name is called as explorative cytology. This explorative cytology This exfoliative cytology are two categories. One is spontaneous exfoliative exfoliation. Second one is mechanical exfoliations. These spontaneous exfoliations means cells are spontaneously shelled. Cells are spontaneously shedding from that surface. Um, Means no external effect to take out the cell, no external effect. Okay, so automatically there are settling from that surface, coming into that fluid. It can be possible in the examples pleural fluid and peritoneal fluid, pleural fluid from lungs cavity. So what is spontaneous exfoliations? Cells are spontaneously shedding from that surface, no external effect. Okay, no external effect. This one, okay, external effect to take out the cell. Automatically there are shedding from that surface, coming into that fluid. Okay, example pleural from lungs cavity and peritoneal fluid. Second one is mechanical exfoliations. Seeing cells scrapped, okay, from surface. Cells scrapped from surface. Here we can use external effect, brush or scraping brush. Cells scrapped from surface which can used in branchial branchial brushing, then pap smearing from cervical scraping, then oral cancer from oral scraping done. So this one, no external effect to taking out the cell, it is presented surface. Okay, this one we are using external effect, brush or scraping brush we can use. Then there are two type of exfoliative cytology. In exfoliative cytology, there are two main technique are using. One is conventional cytology, um, formed by fine fine needle aspiration cytology. Second technique, liquid based cytology. So this exfoliative cytology, we can use two technique. One is conventional, another one is liquid based. Coming to second part, interventional cytology, you have to intervention. Who have to intervention? These are pathologists or clinicians. They have to intervene the biopsy from that body. For example, suppose patient have lymph nodes. Pathologist or surgeon have to intervene. They take out biopsy from affected area. That's what it is called as interventional cytology. So pathologist or clinician intervenes body fluid. So pathologists or clinicians intervenes body fluid for sample collection. It also having two sub branches. One is fine needle aspiration cytology. Second one is sediment cytology. What is mean FENAC? Fine needle aspiration cytology. You have to use fine needle which has been attached to the syringe. From there you have to collect sample. Okay, it have attached with the syringe. By using that we can collect the sample. You are putting needle and insert into lymph nodes and taking out the sample, that is called as fine needle aspiration cytology, FNAC. What is the size of needle? 23 to 27 gauge. Mm, Then cells are aspirated by negative suction. Negative suction will fill the cell material in the needle or needle hub. Second method, sediment cytology. Surgeon or operative person has taken out the tissue and they kept them into that fixative, that means formalin. Now the biopsy kept into that fixative. We are going to take out that fixative. See, biopsy kept into fixative, we need to study about the cell. So what we are going to take out fixative solution which were biopsy were fixed, because some cells are which has been shut down from biopsy. How we are going to deal this? We are going to keep this fixative into the syringe and going to perform centrifugation in fixative solution. After fixative solution centrifugation, we are going to prepare cell sediment. That's why it is called as sediment cytology. So here fine needle we are using, here biopsy fixative we are using. After that sedimentation, cell sediment is prepared. Basic is to take out single abnormal cell from that fixative which has been taken out from the biopsy specimen, then centrifuging and prepare the cell sediment, that is called as sediment cytology. Third branch, imprint cytology. We are taking out the tissue biopsy taken out. This biopsy tissue touches on the slide. Okay, touch on that slide, glass slide. Now cells are imprinted on slide. Here imprinting, already imprinting. That's why it is called as imprinted cytology. It is most commonly used on lymph nodes biopsy. So this is the picture. This one is the biopsy. Okay, these are the already imprinted cells. So here what we will do, we are taking the tissue, biopsy taken. After that, touch on the glass slide, the cells are imprint. Here the printing is there, so it is have the name imprint cytology. Next, what are the requirement for fine needle aspiration cytology? First of all we should know, we should take out um, samples from patient and explain the procedure to the patient in well explained manner. So patient should also aware, should prefer for all those outcome. We required syringes and needle size 23 to 27 G. Then pistol grip syringe holder, that is very important one. There are two type of syringe holder. One is frangels handles, second one is chemico syringe holder. Two type of pistol grip syringes. One is frangels, second one holder handler, second one is chemico syringe holder. Third thing, we required slides and coupling jar. Slides, put a specimen or cell on the slide, and the slide keep into that coupling jar. Okay, coupling jar. Finally we required fixative. Fixative fix that cytological specimen. So basic requirement. So these four things are basic requirement for cytological study: syringe and a needle, then this pistol grip syringe holder, then slide and coupling jar. Fourth one is fixative. This one look like a gun. That's why it is called as pistol grip syringe holder. Can be chemico syringe or Branzel syringe pistol. Basic purpose to help the pathologist. This one why we are using, to help the pathologist or clinician to palpate that lesion from one hand. Palpate the lesion from one hand and the second hand holding the gun, so they can do the biopsy. This is basic advantage. One hand free for mass location, one hand free for taking biopsy. After taking out that biopsy, we will prepare the slide, taking specimen on the slide and keep them inside this jar. Okay, coupling jar. Uh, this is the slat here. Okay, the slat is there, or 5 slat is there. We will keep our slide here. 1 2 3 5, totally 5. So what is the advantages of coupling jar? Used for staining and process. It will fix the slide and we can stain also and dried them also without removing from the jar. So no needle to take slide outside jar. Fixation and staining both can be done within the jar itself on the slide. That is the advantage of that coupling slide staining jar. Then two important basic things: fine needle aspiration cytology. Fine needle aspiration. Okay, biopsy, FNB, fine needle biopsy. fine needle biopsy with aspiration and without aspiration. There are two techniques, with and without aspiration. What are the different? Syringe is having planker along with them. When you are having syringe along with the needle, they are with aspiration. Without aspiration, you are having using to only needle without syringe. This one is the basic difference. So with syringe, with aspiration, without syringe, only needle means without aspiration. So first one is FNB with aspiration. Um, Needle going to the mask. Okay, this one is the mask. Needle going to the mask, going to pull up. Okay, so going to pull up planker. This one is the planker. We are taking out blanker up. What will happen? That creation of that negative pressure. So when we will take out that time, creation of negative pressure, this negative pressure will be taking out tissue into the needle. Now the cells will be inside needle. Now you are going this to up and down. Okay, up and down, taking samples here like that. So after that, negative pressure going to be released. Now taking out needle from that. Now taking out needle from this mass. Now separate needle and syringe. We want to separate needle and syringe. After separation, pulling the blanker. Okay, pulling that blanker. So blanker is pulled out again. Why pulling? So the air to the syringe, so that air will be used. These steps, syringe and needle attached. When you are moving that blanket down, what is happening? The air pressure which has been created inside that needle, the air pushing the cell on the slide. Now samples blown onto microscopic slide. This is called FNB with aspiration. You are aspirating with the help of negative pressure. So here syringe along with the needle, by using negative pressure, we blew on the microscopic slide. The cells blown on to microscopic slide. Next, F&B without aspiration. In this, we are just using needle without any syringe. You are inserting needle into the mass abnormal cells at any location, not only single location, any location. So you have make various angle. So needle are moved back and forth, varying their angle. Abnormal cell are presented at any location. You will take all the abnormal cell for examination. After that, take cell from mass and apply the slide with the help of syringe. We are creating air, and this air push the cell into the slide. This FNB without aspiration further go to cytological study. This method mainly used for vascular lesion for thyroid to reduce the bleeding. So this method mainly used for vascular lesion for thyroid to reduce the bleeding. Next, fixation. Why we required fixation? For any kind of pathological tissue or cell to preserve architecture of the cells. Okay. So fixation, why we are using? To preserve cytomorphology of cells. Cell have extract size and shape. What they actually exit in our body, that's we record for fixation. Otherwise there are small or larger, difficult to proper interpretation of pathology. For that purpose we record. There are two methods for fixation. When we are taking the sample on the slide, we will be just keeping them air, and we are drying with the help of air. It is called as air drying method of fixation. After taking sample on the slide, we are going to tip them into that alcohol solution. So it is called as alcohol fixed. It is called as alcohol fixed because that alcohol is wet, so it is called as wet fixed smear. So two type of fixation, one is air drying and alcohol fixing. For this fixation, what type of stain we are using? Air drying method we are using Ramanowski staining. We Ramanavsi staining, which has the following family members: Jimsa staining, Mary Ruward Jimsa staining, Leishman staining, and Wright staining. In this wet fixed smear, we are using Papinicolo staining and hematotoxin and eosin staining. So two type of fixative, air drying and alcohol fixing. This one we are using Ramanowski, this one Papinocola and hematostyling and eosin staining. Next, fixative. Ideal fixative. In this one we are using equal part of ether and ethanol, 95 percentage. What is fixative? Ideal fixative means equal part of ether and ethanol, 95 percentage. Most common fixative, commonly we are using this 95 percentage ethanol because this ether is flammable one. Then fixative timing 10 to 15 minutes at room temperature. Suppose we want to transport the smear, means we are using that coupling jar.